Hello, everyone. Welcome to this video. Pretty excited to be doing this video because I'm here with Athena Drewes, who I've known for quite a long time. I don't know how long, but it's been a while. She's an awesome person, and she's talking about something really cool today, which is cognitive behavioral play therapy. I'm so excited about this because I feel like I get asked a lot of questions about this play therapy approach from supervisees and other people. And it's just really nice to, do this video and have somebody who can share a little bit with us and point us toward other resources and information. So, welcome. Thanks for being
Thank
here.
you.
And,
Thank you.
the first question really is just what is cognitive behavioral play therapy?
Sure. Well, it has its roots. I have to kind of go back a bit to the history to cognitive behavioral therapy, which deals with cognitions, behavior, and social learning, basically changing negative behavior in a structured and very directive, goal-oriented way. Skinner, Watson, Volpe all use behavioral aspects to change behavior. And then Beck came along to try to help people with depression, changing more cognitive components. And cognitive behavioral therapy itself is really one of the most frequently utilized treatment approaches in mainstream psychology because it can be manualized, and as a result, you can have research and you can kind of prove your premises and see explore the aspects of what's going on in people's lives and behaviors and thoughts. So um, Beck came along and wanted to combine cognitive and behavioral theories and approaches in dealing with depression into one formal way. And his view, which is actually a premise of cognitive behavioral therapy and CBPT, play therapy end of it, is that thoughts and behaviors and emotions are related. So if you change the thoughts about ourselves, about others, and our beliefs, then you can have new emotional and behavioral experiences. So by changing behavior, we can change how we feel or how we think. So irrational thoughts are the underlying reason for psychopathology from Beck's point of view, and because it impacts feelings and behaviors. So cognitive behavior therapy really doesn't have a personality theory per se, rather that the psychopathology is caused by these unhelpful thoughts. And you can have thought distortions and maladaptive behaviors and that play a role in maintaining psychological disorders and distress. So these unhelpful thoughts that can come from experience, from trauma, from current events, past events, are going to impact the feelings and behaviors and lead to depression, anxiety, behavioral acting out, things of that sort. So CBT has a lot of empirical basis. And sort of jumping ahead a little bit to question two is that it's often used to treat depression and anxiety, addiction, PTSD, trauma, other behavioral or concerns. But for younger children, it's predominantly a nonverbal way of working, and I'll get more into that in a bit, blending the play and play-based techniques along with the cognitive behavioral treatment approaches and method. So because abstract thinking occurs around age 8 to 10, traditional directive talk therapy using CBT requires that sort of abstract ability and thinking, having complex ideas, which is fine. You can use CBT in that direct way. But when you have children that are 8 and under, which a lot of our play therapy clients are, you're going to find them being much more concrete. They're not going to understand these concepts or be able to work with them or grasp, how their thoughts are impacting their behaviors or feelings impacting behaviors. So they don't have that language and understanding of the language to do it. So also, we know for kids in play therapy, they need to have a sense of mastery and control. They need to feel like they're leading the work. So you have to have an integration then of these concepts with play and play-based work to help change some of the negative behaviors and things that are getting them in trouble, and help them aware of their feelings, help them aware of their thoughts that are impacting all of this. So Susan Nell came up with cognitive behavior play therapy back in the late 90s as a way of helping, giving a theoretical framework, basically using CBT principles, but through a developmental framework. So she wrote that rather than assuming young children lack the cognitive abilities to engage in cognitive therapy, we must consider ways to make cognitive interventions more developmentally appropriate and therefore accessible. So as a result, she started working with children, especially age 8 and under, even 10 and under, because sometimes they're developmentally delayed, using a paradigm of play and play-based techniques in a systematic and goal-oriented manner. So it takes into account CBPT, cognitive behavioral play therapy, the developmental factors, as well as using the CBT empirically based approach. So it's very developmentally sensitive way of working, and gives the child a certain amount of control over their environment. They can be an active participant in the change, and it incorporates these cognitive and behavioral interventions, but it's playful in a very play-based way. So psychoeducation is integrated throughout all phases of it. There's all of the play therapy materials that we use in non-directive work is utilized. Use a lot of role playing and puppet work, bibliotherapy and psychoeducation through that, to teach various components and ways of understanding how there's that connection that your thoughts and their feelings are going to result in some negative behaviors or outcomes. And so once the child gets their coping strategies, which you're working on, and you can start working on problem solving skills and trauma narratives. But you can do all of that through play and sandtray and art, expressive arts, mindfulness, relaxation, working on dysregulation and regulation within the child, sensory experiences. So you're helping that child go from, say, a cognition of like, I'm stupid, I never do anything good, into understanding what's the emotion behind that. Well, maybe they're sad or disappointed underneath that, to the behavior that could come out of that, which might be they withdraw, or they get upset or act out or get aggressive. So helping them understand that kind of sequencing that can go on. And as the therapist, as a CBPT therapist, you really want to look at what factors are maintaining those behaviors. What are their strengths? We're very strength-based, looking at strengths, coping strategies. What do they need help with? What's influencing the problem or maybe sustaining it, like parents or peers or school. Looking at problematic thoughts like, I'm stupid, I can't do anything, I'm no good. And then guiding through emotions and behavior. So internalizing problems, which we know as anxiety, depression, shyness, and externalizing, being impulsive, aggressive, oppositional, are the areas that are really can be addressed very well with CBPT, especially trauma, complex trauma, dysregulation, oppositionalism, anxiety, school phobias and anxiety stuff. So the basic components that you would work with in the sessions that you would build in your treatment plan would be looking at the physiological aspects, as there's dysregulation, how to help the child calm down, relax, cognitive restructuring so that they might say, oh, the world is against me, or I can't trust anybody, and helping them understand where that came from and how that impacts them and how they can change that. Working on problem solving skills, a lot of executive functioning.
Mhm.
How can they break down the tasks so they don't get overwhelmed and understand consequences of their actions? A lot of modeling, role playing, skill development, things of that sort go on in the treatment process. So although it's directive, it can also be non-directive. You need to create that relationship. You need to be able to have the child engaged and feel like they're really able to be part of it,
Mhm.
as well as you want to be directive and work on some of these issues that are bringing them in to see you, and give them techniques and ways to function better and respond better on that. Sometimes we give homework, go home and try this. We don't want to call
Right.
it homework because
Right.
kids don't like that. But,
No,
I want you to go and try this out at home or try it at school and tell me in a week, when I see you, how did it work? Or I want you
Mhm.
to think about this, or here's a coping strategy. I want you to use it when you're feeling upset, and teach it to mom and the parent or the dad, caregiver, so they can try it out and use it and remind the child. So that's kind of a quick summary of
It
where
was a good summary.
CPT came
I kind of
from.
wondered how you were going to do a quick summary because I mean, there's a lot, in this theory. So one of the things you mentioned, well, a couple that I thought was really neat was, of course, the strengths-based focus, which maybe people don't always realize, but how great that is, of course, for kids. And then when you were describing, this bringing together play therapy approaches, methods with the CBT principles, or some of them, right, that are developmentally in line with kids. It almost just sounds like kind of a little bit like integrative therapy in a way. Like what you're
Mhm.
really doing is kind of integrating these play therapy approaches and methods you have with these CBT principles in a way that's going to work for this client in front of you. So almost like an individualizing down for this
Absolutely.
client.
Mhm. Yeah, it's very much an integrative approach because you're taking um, what could be manualized. There are different approaches, like trauma focused CBT is very manualized, but you can bring in play and play-based activities into that. And so you're integrating that into the sort of the format of something that's manualized, but you can also structure your sessions, and that often I would do that in a way of checking in the first 5 minutes with the child, or checking in, did you try these things, how did it work, let's talk about that, or how was your week, or this is what I heard from school or your mom. And then I'll spend about 15 minutes on a structured activity that may be CBT directed in terms of my treatment plan, like affect regulation, or helping with understanding the through puppet, showing a puppet how thoughts and feelings and behaviors are related, or looking at particular behavior. So the child knows it kind of, okay, I've got to deal with this, very structured thing. And then having the rest of the time be non-directive, where you can see what's going on through more of a child-centered approach and their activities. And then the last 5 minutes or so, again, reinforcing some of the affect regulation, deep breathing, blowing bubbles, so they can transition out of the session, and also have these coping skills to try and reinforce. So that's one way you can blend effectively, play therapy with CBT in a more structured way. Of course, it depends on the child. As you're saying, you want to be prescriptive on what you need to do. What's the child's developmental level? Can they take more verbal direction? And maybe you spend a longer session on it, but you don't want to make it so the child doesn't want to come back. You want to make it fun and inviting. And of course, you've got to have that treatment relationship. So I often start out the first several sessions, if I can, non-directive. I want to learn about the child. What's their behavior? What's their worldview? What's their developmental level? And then kind of progress into how much CBPT do I need to do in a session?
Well, you mentioned several possible therapy needs, diagnosis that a child might have, which might be a good fit for cognitive behavioral play therapy. Obviously, we're talking about children as a population when we're kind of implementing this type of play therapy. Any other additional mentions there? I think you kind of covered probably the bigger ones that we see
Yeah.
in
Yeah.
play therapy, right?
Anything school-based, you get children having school avoidance. You have phobias, a child might have gotten stung by a bee or, where they, have develop a phobic reaction to insects and
Mhm.
don't want to go outside.
Yeah.
You have attachment disorder issues where there's separation anxiety. It's almost, I would say it could cover just about everything, and the beauty, as you mentioned, in an integrative approach, as well as being prescriptive, is that, you can move in and out and bring in other things along the way if you have to, and incorporate. Adlerian therapy, play therapy, in some ways parallels a lot of what CBPT is. It has its directive approach, it
Mhm.
has its non-directive approach. It's using the same materials, but the theoretical basis is different,
Right.
and its vision and goal is slightly different. But you're still, you're blending in directive work and non-directive work.
That's great. Well, how would someone who might be interested in, taking more trainings on cognitive behavioral play therapy, reading about it, what are some resources that we could provide?
Sure.
And I'll make sure I post them on the video as well.
Interestingly enough, there's not a lot of literature out there specifically to cognitive behavioral play therapy. There are techniques books out there for your like trauma work that will incorporate CBPT. But Susan Nell's book, which was the primary first book to come out called Cognitive Behavioral Play Therapy,
Mhm.
is still out there and available, gives a good foundation. Blending play therapy with CBT, evidence-based and other effective treatments and techniques. Not to self-promote, but
Yes,
which
that's
I
okay. You can.
edited
Yes.
way back as exactly for that purpose, to help people understand how to blend it a bit more. Um, there is a book coming out to meet this need in next year, or 2024, 2025, called The Handbook of Cognitive Behavioral Play Therapy,
Oh, wow.
Clinical Applications in Practice,
Okay.
that myself and Lisa Remy are co-editing together. So that's on the just starting, it's emerging in the process. It hasn't been fully written and authors selected yet,
Okay.
but its goal is to be that kind of a handbook. Somebody
Sure.
wants to know about CBPT. How do you do it? What is it? What does it look like? And then, what are case examples and situations where it's applied? So those are several of them. Of course, coming to any Association of Play Therapy
Mhm.
conference, hopefully you'll be able to get some training that way as well.
Yeah, I know you do those trainings. You train at the main national conference on this topic often, and you are available to be contacted
Oh,
to
yes.
do a training. So that's another option for folks.
And you can certainly put my email address out, drathena.drews@gmail.com, if people have questions, if they want more information or where to go. Feel free to contact me too, or anything that I spoke about.
That's great. Well, thank you for taking the time and, trying to summarize this down, give us the highlights so people can know a little bit more about this play therapy theory.
Great.
Yeah, I
Thank you.
appreciate you being here. We're going to wrap it up and say goodbye. Thanks for watching. Come back and check out more videos. Thanks, Athena.
Thanks.